Hi everyone, I am Dr. Tinku Joseph. I work as one of the interventional pulmonologists at Amrita Hospital based in Cochin. In the next 15 minutes, I'll be talking in brief about the different kinds of face masks which is available in our market and how to choose the best face mask. Ever since the COVID-19 pandemic had set in, most of us knows that the mask has become a unique or a trustworthy friend of almost each and everyone who is living in this world. First and foremost, we have a single layer face mask, then a double layer face mask, triple layer face mask, then we have the dust mask, the N95 variant of masks, as well as we have the Elastomeric Respirators and then PAPR or the powered air purified respirators. So different kinds of masks are available in our online as well as the offline market, but how to choose the best one? Single layer face mask is the one which is made of tissue or a paper or a fabric, and unfortunately this does not have any form of filters and it gives absolutely no protection against COVID-19 infection. So as the name denotes, it has got two layers, but unfortunately there is no filter in between the two layers, which is made of non-woven fabric. Two-layer or a surgical face mask also does not offer any form of protection against COVID-19, but it is a mask which has been predominantly used by the surgeons or the doctors who are in the operation theater to avoid spillage of secretions to the face of the surgeon. Now next comes the triple layer face mask or the 3-ply or 3-layer face mask. So as the name denotes, it has got three different layers. Outer two portions are there, which is made up of the non-woven fabric, and it has got a filter right in the center of the mask. So compared to your single layer face mask or a double layer face mask, triple layer face mask offers up to 45 to 50% of protection from COVID-19. Now next comes the dust mask. Dust mask is the one which often most of us gets confused as N95. It is available widely across in the online market. Appearance wise, it resembles an N95 mask, but it is not an N95 quality. It offers 0% protection against transmission of COVID-19 infection. Only in the shape it resembles an N95, but it is made of wood pulp or tissue paper. It offers 0% of protection against COVID-19 infection. Now next comes the widely used or most popularly used face mask in India, that is a cloth mask. So before mentioning about cloth mask, you should be aware that cloth mask offers 0% protection against COVID-19 infection. The only advantage of using a cloth mask is that if the person is suffering from cough or sneezing, the cloth mask will prevent spillage of the secretions during coughing and sneezing to another person. So rather than not wearing any form of mask, it would be better to wear at least a cloth mask, because it prevents the transmission of infection through larger droplets. If you are using a cloth mask, it should be preferably made of 100% cotton, and it should have 3 layers stored and used properly in such a way that if the person who is using cloth mask, if he wants to reuse it, preferably wash it in hot water and air dry it, or else he can wash it in soap solution and air dry it. If you have the facility to use 0.1% chlorine, you can dip it in chlorine solution and again air dry it. So these are the different ways by which you can reuse a cloth mask, but keep in mind that the cloth mask does not offer any form of protection against COVID-19, and you should use this with caution. So N95 mask is a form of respirator which is made up of millions of electrically charged polypropylene fibers. These fibers which filters out the viral particles. The viral particles gets lodged inside the polypropylene fibers, and thereby it helps in preventing transmission of infection. So like N95 mask, there are different other variants of respirators are available in the market, like your N99, N100. N100 gives almost 100% of protection against COVID-19. So this N95, N99 and N100 variants are primarily manufactured in USA, and it is certified by NIOSH. Similarly, every country has got its own grading system. The FFP variant is primarily the grading system which has been followed in European countries. So we have the FFP1, P2 and P3 mask is there. Preferably avoid using your FFP1 because it offers less than 85% of protection. If you're planning to buy an FFP variant of mask, it should be either FFP2 or P3 quality. Now, like the American and the European grading system, there is also a Korean variant KF grading system. KF1, 2 and 3 is there. It is almost same as the American and as well as the European grading system. Chinese variant is called as the KN95 and KN99 and KN100 is there. So compared to the American and the European variant, the Chinese form of respirator is touch different because it has got ear loops, whereas the American and the European ones has got bands which goes around the head as well as the neck. In India, the mask which has been produced in India should have a ISI logo, which has been considered as the mask with decent quality. So the original one, let it be of any company, it should have 5 key points written on top of the mask. The name of the manufacturing company, then the variant, that is which grade it is. If it is N95, the N95 has to be written on top, or else FFP2 or P3. Then we have, if it is made in India, it should have ISI logo. Then the batch number, the lot number of the mask should be mentioned. So only if these 5 points are there on the mask, it has been considered as an original variant. So it's very important point which you should remember that the government of India has already banned using a face mask with valves, any form of face mask with valve, because it can transmit the infection from an infected individual to other person. So wearing any form of face mask with valve is banned, and it should be preferably avoided because you might potentially transmit infection to other person. It won't be comfortable for everyone to wear an N95 mask. People who are suffering from any form of cardiorespiratory issues can wear an N95 mask with valve to avoid suffocation. These are the only group of individuals who have been excluded from wearing an N95 mask with a valve. First and foremost, buy the original quality N95 mask. Number 2 would be that if you are using an N95 mask, it should be worn properly. The strap should be held in place tightly. Do a fit test. And if a beard is there, it has to be removed because the viral particles can at times track through the side of the mask. Avoid using a triple layer face mask inside the N95 mask. The triple layer face mask can be worn outside the N95 mask to avoid leakage. And number 4 would be avoid reusing or using N95 mask for an extended hours. The standard recommendation from various manufacturing companies is that an N95 mask can be used for up to 9 hours at a stretch. It should not be reused if you use it beyond 9 hours, or else if you reuse it, especially in Indian setting with a lot of humidity and our tropical climate. Most of us tend to sweat a lot, and the sweat gets clogged inside the N95 mask, and it acts as a potential culture media for the different kinds of fungus to grow in. Elastomeric respirators is a form of mask which often resembles, if you wear it, you will resemble an alien. Prior to the COVID-19 pandemic, elastomeric respirators were the kind of mask which is primarily used in petrochemical industry, paint manufacturing, welding, and other occupations which deals with various kinds of fumes. Ever since the COVID-19 pandemic has set in, a lot of healthcare professionals have started using elastomeric respirators. It generally gives a much better protection compared to your N95 mask, and the people who are wearing this are much more comfortable. It has got half face and full face elastomeric respirators are available. If you are using a full face elastomeric respirator, especially for people like me who is having beard, it generally covers your entire face, and it won't give the kind of suffocation which we feel when you are using an N95 mask. Elastomeric respirators also has got how it is different means, as shown in this photograph, it has different kinds of filters are there which can be attached to the mask. The filters are of N95 as well as N100 quality, as well as we have the R variant and the P variant of filters available. Among the different kinds of filters, whenever you are using an elastomeric respirator, you can use P100 variant, the ones which comes in pink color. So compared to your N95 mask, if you are using an elastomeric respirator, it won't be that suffocating, and the people will be much more comfortable if you are wearing an elastomeric respirator. The problem is, compared to your N95 mask, it is much more costly, and in order to clean the mask, it is also a difficult task which goes against your elastomeric respirator. Now the last variant of face mask is your powered air purified respirator, or a PAPR or a PAPR. So compared to all other variants of face masks which I mentioned before, the powered air purified respirators offers almost close to 100% protection, and it is one of the most comfortable form of face mask which is available at present in the market. If you wear it, it has got a hood and which covers your entire face and neck, and it has got a device with HEPA filters. It's been operated with the help of battery, and once the switch is turned on, it takes the air from outside. The air is filtered through the HEPA filter. If you are performing any form of prolonged surgical procedures, you can use a PAPR because it is much more comfortable. So I had mentioned different kinds of face masks, starting from single layer, 2 layer, 3 layer, dust mask, cloth mask, N95, elastomeric respirators, and the PAPR device. So among all this, I would say the N95 mask or the FFP2 mask is the most ideal one which you have to use to prevent getting infected from COVID-19 virus. It is not only the mask which is going to give you protection from COVID-19 infection. Along with using your face mask, you also have to follow the policy of social distancing, hand sanitization, and mandatorily take vaccines as well. Only by following these 4 strategies, we'll be able to prevent transmission of COVID-19 infection. Thank you.